Good morning and welcome to UroNurse News. I'm Vic Senese. Today we're diving into a fascinating topic, reshaping outpatient urologic care with the use of local anesthesia for Rezūm treatments. Now, Rezūm is a minimally invasive treatment for benign prostatic hyperplasia, or we call BPH, condition affecting millions of men worldwide. Traditionally, Rezūm has been performed using sedation or general anesthesia. But what if we could make it even more accessible, like using just local anesthesia right in the outpatient clinic? A recent narrative review explored this very question, analyzing current practices and protocols for local anesthesia in Rezūm procedures, and evaluating pain management, feasibility, and patient comfort. The goal? To determine whether Rezūm could safely and comfortably be performed without the need for deep sedation. Now, the research team conducted an extensive search across Medline, Cochrane, and Embase databases, reviewing studies published between January of 2015 and June of 2024. They focused on studies that specifically reported the use of local anesthesia in Rezūm procedures, measuring patient comfort levels, pain scores, and overall procedural outcomes. Because of differences between study designs, a narrative synthesis was chosen. Instead of a traditional meta-analysis, that means they summarized and interpreted findings across different studies rather than trying to combine the data statistically. In total, 4 studies met the inclusion criteria. Each used different techniques for local anesthesia, including transurethral intraprostatic anesthesia using a Schelin catheter, that's that long needle that you can inject through under ultrasound, and prostatic nerve block, combined with cold anesthetic gel. Across these methods, results were consistent. Patients experienced effective pain control, allowing Rezūm to be performed safely in outpatient settings. Functional outcomes were also impressive. Improved Qmax flow rates, reduced IPSS symptom scores, that's the International Prostate Symptom Score, and better quality and high catheter independence rates. And importantly, only minor complications were reported. So what does this mean for clinical practice? The evidence suggests that Rezūm under local anesthesia is both feasible and effective. It offers significant advantages in patient comfort and opens the door for broader outpatient application, reducing the need for operating room time and anesthesia resources. However, the review also noted gaps in the research. There's still a lack of standardized anesthesia protocols, and we need more data on long-term outcomes and comparative efficiency. Future studies should aim to fill those gaps, to optimize Rezūm and potentially shift BPH management towards office-based cost-effective solutions. So this review highlights promising evolution in urologic care, one that prioritizes comfort, accessibility, and innovation. And on a side note, one of the things I did before I retired was a lot of these Rezūms with the urologist in our group, and he was the guy who did the most Rezūms. We did all these under a prostate block, as we talked about, that transrectal ultrasound prostate block, a little lidocaine jelly into the urethra, and then we also sometimes would use some what we call Pronox or nitrous oxide, and that combination worked out great. Patients hardly knew they were having it done. So it does work. I can attest to it personally, not have the procedure done, but attending many of these procedures. So what's coming up tomorrow? Well, tomorrow on UroNurse News, we're bringing you a remarkable breakthrough in prostate cancer care. A recent case demonstrates how triplet therapy, a powerful combination of androgen deprivation therapy, darolutamide, and chemotherapy, achieved complete PSA remission in a patient with multi-organ metastatic recurrence after prostatectomy. I was just at a meeting for our nursing group. It was done in Louisville, and this was one of the lectures I went to, and it really had some impressive information. So, hey, prostate cancer has really come a long way since I started practice. But anyway, tomorrow we'll break down exactly what this means for patients, clinicians, and the future of high-risk prostate cancer treatment. That's it for today. I'm Vic Senese. Thanks for watching. Be sure to like and subscribe, and we'll see y'all tomorrow.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view. UroNurse News, straight to you.